What does it feel like to go from tissue expanders to implants? Is there a relief in tension like you hear some people say? What's the recovery like compared to your mastectomy? This video covers what to expect with your exchange surgery. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. An exchange surgery is part of a two-stage reconstruction. Tissue expanders are placed either at the time of your mastectomy or delayed down the road. They're expanded over time and then replaced with implants during a second surgery. This is what I had after my double mastectomy. Breast implants vary in shape, size, filling type, and projection. Some of these were discussed with my plastic surgeon, and some of them she chose automatically. The shape of implants can be round or teardrop shaped. Round implants are more uniform from top to bottom. Teardrop implants are thinner at the top and then slope to a fuller bottom to mimic more of a natural breast. My surgeon chose round implants and they seem like they're the right fit for my body. The size of your implants are based on the capacity of your tissue expanders. You'll have a discussion with your plastic surgeon for what your preferred size will be for your eventual implant, and this will take place prior to the tissue expanders being inserted. After getting your expanders filled and you're content with the size, then your plastic surgeon will figure out what this will be in terms of an implant size. There isn't an exact conversion of how many cc's are in a tissue expander with how many cc's are in a silicone implant. For example, I had 275 cc's of saline in my tissue expanders and my implants are 310 cc's. It's interesting that even though the volume is larger in the implants, they don't actually look larger than when I had tissue expanders, which has less volume. The diameter of an implant is another factor that comes into play with size. A wider implant with the same volume won't project out as far as a similar implant that's just more narrow. How an implant looks can also be affected by your body proportions. My surgeon and I discussed the size of the implant, but not the width, as she determined that. The filling type can influence how an implant looks. I'm going to be focusing on silicone implants as this is my experience, but some women may opt for saline. Many of the silicone implants are called gummy bear implants. If you were to cut them open, they're squishy but still solid, so just like a gummy bear candy. The projection, or how far the implants go out in front, can affect your profile. My implants have less projection than my expanders did, and this is what my plastic surgeon typically recommends. For reference, I put the exact details of what implants I have in the description below, but mine had a moderate projection. My surgeon said you can opt for implants that have more of a projection, so if your preference is for your implants to look more like your expanders did, then this is an option. Even though your plastic surgeon has predetermined the size of your implants before your exchange surgery, they use something called sizers in the OR to determine the final size. The sizers are like empty implants and they put these into the mastectomy pocket or where the tissue expanders used to be. They fill them with saline and then they're able to determine which amount of fill suits you best. Then they would choose the appropriate implant size based on this. It's weird to think all of this is happening while you're unconscious during surgery, and I would have loved to be awake to have a say. I knew ahead of time that this is how the implant size would be chosen when I'm not awake, so I discussed my preferences with my plastic surgeon beforehand. I requested if my surgeon needed to go bigger or smaller compared to my expander size, that I wanted to go smaller. I'm pretty active and I thought a moderate size would be more proportionate to my body. I also thought it would be better to go smaller and wonder if I should have gone bigger than go bigger and regret it. The timeline for your exchange surgery can vary depending on what other types of treatment that you're getting. Because I was having radiation, my surgeon recommended waiting 6 to 9 months after radiation was completed. If I wasn't doing radiation, the timeline could have been as early as 3 months after my mastectomy. If you look this up online, you'll see quite a variety in timing depending on the surgeon. I ended up having my exchange surgery 13 months after my double mastectomy. Let's get into the details with the exchange surgery. The morning of the surgery, my surgeon drew on my chest with a marker. So she drew down the midline and then under the breast folds, and this would help with symmetry when I would be in surgery. She also drew a few arrows on different parts of my body. On the side that had cancer, my surgeon drew arrows going down as she was going to move that breast slightly lower. There's a side effect of radiation with radiation fibrosis where it's a tightening and sort of contracture, and the breast can sometimes move up. Mine was quite mild, but it was still beneficial to address this during surgery. On the unaffected side, my surgeon drew arrows inward because the tissue expanders, when they were placed, was placed a bit more laterally or out to the side. So the arrows were for her to move that breast closer to the midline. Your surgeon will generally use the same incision that they use for your mastectomy. Mine is in through the center, and some people will have it under the breast fold. This will depend if you had a nipple-sparing mastectomy or a skin-sparing mastectomy. On the side that had cancer, the skin in that whole area was quite tight as they took more tissue out and more skin out as a part of the mastectomy. Radiation can also further tighten the skin, and so my surgeon went right through the same incision that I had for my mastectomy and didn't take out any more skin. On the unaffected side, my incision was completely taken out and additional skin was taken out, and then I have a new incision. There was more skin left over on this side after my mastectomy, so removing that skin just helped with symmetry. What do implants look like? They do look good under clothes, but this definitely isn't a boob job. They're more natural looking and they tend to sit a little bit lower than tissue expanders, but this can vary person to person. The contour of the breast will depend on the shape of the implant. The contour also depends on where your implants are placed, whether they're over the muscle or under the muscle. With under the muscle, there tends to be more of a natural slope that comes down from the chest wall into the implant. With over the muscle, there can be more of a clear shelf coming down from the chest wall into the implant. My implants are under the muscle, and on my unaffected side, there is that natural slope. On the side that had cancer, there is actually a bit of that clear shelf. Because more tissue was removed during the mastectomy to get a clear margin, the remaining skin is very thin and there's less padding, and this goes all the way up from the breast to the collarbone area. This difference side to side was also there when I had tissue expanders, so this isn't new. If I had larger implants, this shelf might be more obvious, but with my size, it's really not too much. I also have rippling on basically all sides of my breast, but only on the side that had cancer because the skin is so thin. I could do fat grafting for the rippling and to fill the area above my breast, but honestly, this doesn't bother me enough to justify doing another surgery. What's the difference when you're wearing bras? When you wear a sports bra, implants don't squish like they do with regular breast tissue, but they do squish a little more than they did with tissue expanders. There's a certain amount of projection with implants that you'll have no matter what type of bra you're wearing. In terms of exercise, if I were doing any bounding type movements like skipping or running, there is some movement of the implants up and down. When I had expanders, they hardly budged at all with exercise. What do implants feel like? One of the first things I did when I woke up from surgery was to push on the implants. In between the two surgeries, I had some capsular contracture and radiation fibrosis. So basically the breast and some of the surrounding areas just felt very hard and tight. This was in addition to how hard and tight tissue expanders feel. The hardest area was this lower portion, and I found myself just sort of repeatedly squishing this area because it felt so different. I was so excited to have something that felt somewhat like normal breasts as compared to having these hard breasts with tissue expanders for over a year. How about sensation? I still have reduced sensation in my breasts, mostly in the central breast area, out to the side, and then on this side only, obviously into my armpit where the lymph nodes were removed. I have a bit more sensation though as compared to after my mastectomy. I do still feel like there's something foreign in me, which of course, because there is, but I think it's the combination of implants plus the lack of sensation that contributes to this feeling. This foreign feeling has been less with implants as it was with expanders, because I think implants have that natural give that expanders don't. I'm just over a year out from my exchange surgery, and I would imagine that I'll feel like they're more a part of my body as more time passes. How about the recovery with your exchange surgery as compared to your mastectomy? In general, there's less recovery time needed, although everyone's pain experience can be different. I had significantly less pain as compared to my double mastectomy, and by a week out from surgery, I was actually feeling quite good. The biggest change is you don't have drains with your exchange surgery, and this makes a huge difference. You can move around so much easier, and sleeping isn't as complicated because you can sleep on your side at an earlier time. I also had less compensation type pain in some of the surrounding areas, so mostly in chest and mid-back area after my mastectomy. I did, however, have some low back pain after both surgeries. That vice-like tension that many women get across their chest and mid-back was significantly reduced, almost to the point that it was non-existent after surgery. The cording that I had that went down my arm and then the other way into my breast also improved right after surgery, and sort of the overall tension in my whole chest area felt better. There was also an improvement in my shoulder range of motion after surgery. I had near full range of motion up overhead after the mastectomy, but I noticed there was so much tension when I went to those end ranges. After surgery, the movements with my arms in all those directions felt so much more free, and I noticed the difference actually probably within a few days after surgery. There was some tightening up that started about 4 to 6 weeks after surgery, which is expected, but it was minimal and never went back to what it was pre-surgery. In terms of function, I could do more with everyday activities at an earlier stage with this surgery as compared to my mastectomy. I did have some setbacks, like I said, with radiation fibrosis, where it affected my shoulder range of motion and some of the activation of those muscles that were in the radiated field. I omitted or modified quite a few movements over the number of months because of this. My expanders were under the muscle, like I said, so I also omitted most chest exercises. Even though I consistently worked out between the two surgeries, I was definitely weaker going into my exchange surgery as compared to my mastectomy. So the recovery from the actual surgery was much easier than the mastectomy, but it has taken me longer to get back to some of the things that I like to do physically. If you've watched a few videos of mine so far and you're not subscribed, consider it. I'll share a few details about my exchange surgery results. My initial reaction after surgery was just simply relief. People will say that cancer treatment is a marathon and not a sprint, and I was super happy to be done with such a big step in that process. For the first 2.5 weeks after surgery, I was wrapped like a mummy with this tape around my breasts. It can be quite variable what different surgeons do, so you may or may not have this. My surgeon said I didn't need to wear a bra with this, as the tape gave quite a bit of support. The tape did make it hard to see what my breasts are actually going to look like, but at this point I was still feeling pretty good. After my first post-op visit with my surgeon, the tape was taken off. The implants did look more natural. I was so used to having these like hard balls under my skin, the expanders, so it took me a while to adjust to my body looking different. Then a few days later, the dressings for the incisions were taken off. So I had the steri strips on the incision and then that tegaderm dressing, which is that clear looking bandage. I actually had more of an emotional reaction when the tape and especially when the incision dressings came off as compared to when I saw myself in the mirror after my mastectomy. When I had my mastectomy, I was in the thick of it with treatment, and I knew that that surgery was only part 1 of 2. You can't really process the whole surgery experience until you've had that second surgery. You don't know what you're gonna look like, you don't know what your function's gonna be, what your recovery's gonna be. For me, being so physical, this was super important. The most challenging part for me mentally was more related to the radiation effects on implants rather than just the implants alone. I didn't realize the extent that radiation affects reconstruction reconstruction. I'm going to do a separate video on this with more detail. I was surprised how the radiated side looked compared to the other side, and even more surprised with how it moved, or basically didn't move compared to the other side. Remember the down arrows that my surgeon drew before surgery to lower that breast slightly? I knew she was going to do this even before surgery, but she actually didn't just lower that breast to match the other one at the same level. She lowered it down further. So this one is actually slightly lower than this one. The incisions that go right across aren't symmetrical like they were after my double mastectomy. My surgeon was really thinking ahead because the radiated side really won't move too much over time, but the unaffected side will, with healthy skin and the implant, lower down slightly. So eventually they will actually be even because this one's lower now and then this one will fall a little bit over time. I was also surprised to see that my scars look quite different side to side. As I mentioned, the radiated side scar was capped and then there's a new scar on the other side. There were a number of months after surgery that I actually second-guessed the size that I chose. Should I have gone slightly bigger? Not a lot bigger, but slightly. Because the first 2.5 weeks I was in that white tape that almost acted like a push-up bra, I was fine at the time, really not thinking about the size, but it was when the tape came off that's when I wasn't so sure. I was still really glad that it wasn't the other way around where I was too big and really regretting that. Filming some of these rehab videos has actually helped quite a bit with acceptance. You see yourself in a different perspective on video. I also do CrossFit and this size makes sense given how active I am, and I also think that it looks proportionate to my frame. So I am actually quite happy with the size that I chose. I'm sure at some point you'll hear people say that you're so lucky to have these breasts that won't sag. While that is true, and I am a glass half full type of person, this usually misses the mark on all the things that happen to us in order for us to get these breasts. It's complex and I'm super thankful to have breasts after going through all of this, but I don't really see implants in isolation of all these other effects. Looking about a year out from my exchange surgery, I have absolutely no regrets in doing a double mastectomy and reconstruction with implants. I would have preferred my implants were placed over the muscle, but even with the disadvantages of them being placed under the muscle, I would still actually make the same decision. Because I always knew that I wanted reconstruction and preferred not to have flat closure, having expanders and then implants has really helped my headspace as I've moved through breast cancer treatment and into the survivorship stage. I wish you well with your recovery if you're watching this video before your exchange surgery or if you've recently had it. See you in the next video.